Coming to us from Germany, Professor Hendrik Schulze-Koops from the University of Munich. Hendrik's going to talk about why meetings should be like Oktoberfest.
Dear colleagues, dear friends, thank you very much for having me, and thank you very much for inviting me to this meeting here in Dallas, Texas, where I spent almost 4.5 years, more than 25 years ago, together with Jack and Artie, whom I really warmly thank for this invitation. I'm very sorry that I will not be able to meet with you in person here in Dallas, but that's about the talk that I have to give and that I want to give to you. Some thoughts about necessity to meet in person when you have friends all over the world, or to rather focus on things that you can discuss with your friends and keep friendship alive in an easier way. My name is Hendrik Schulze-Koops. I'm the chair of the Division of Rheumatology and Clinical Immunology here at the University in Munich in southern Bavaria in Germany. Munich is a wonderful city, which is close to the Alps that you can see here, has wonderful buildings. And this, in fact, is something that we do see every once in a while when we have wind coming from the southern side of the Alps, which is Italy, over the Alps, and then getting into the city where all of a sudden the appreciation is as if the Alps were just an arm away, where they are more than 80 or 90 miles behind the church. What is known for Munich in this particular focus on the talk is the Oktoberfest. The Oktoberfest is something which is a wonderful experience that the Municians celebrate about once a year. This is the main entrance to the Oktoberfest, this slide from 2012, but it looks almost alike with the exception of 2020 and 21, when the Oktoberfest was not taking place because of the pandemic. And this leads me to some important thoughts that I want to address with you today. So what do we do at the Oktoberfest? Well, we celebrate, and of course we eat and drink. This is the famous Brezel. We have some kraut and we have some wonderful cheese, but most important is beer. And this is all served here in the blue and white background of the Bavarian national colors. What does that have to do in common with rheumatology meeting? Well, this is the brief slide of the EULA meeting in 2022, and you would all agree that blue and white is here as well, but it doesn't seem to be so nice and happy and cheerful as the Oktoberfest. But I will come to this in a minute, and I would think that the Oktoberfest will tell us a few things that we might want to take into consideration when we plan the future of rheumatology meetings. Just a few words about the Oktoberfest. The Oktoberfest is the world's largest Volksfest, so the festivity for the entire public. We do celebrate, we do drink. This little lady in the lower part of the slide, she carries 10 mugs of beer, 1 kilo each, so that's about 2.5 gallons that she has in her hands. And the record is about 30 of those being carried from the waivers to the people who would like to drink, and spend the money, lots of money, for getting the beer. And I shouldn't say getting drunk, because that's something that will appear as well. What is the Oktoberfest all about? Well, in 1810, it was founded by the later King Ludwig I of Bavaria, for the Bavarian people to celebrate his wedding in 1810. And 200 years later, you see that the Oktoberfest has slightly evolved into something more modern, of course, but still with lots of festivity, clothing here. And of course, at that time, blue skies more than we had about maybe 200 years ago on this picture, at least. Initially, it was a horse race, and we do celebrate the horse race every year when we have the Oktoberfest as a memory of the founding years. Nowadays, it's the main intention is to really celebrate the existence of this festivity in this wonderful city. It transformed into a public festival during the 19th and 20th century. And in fact, today we have more than 6 million guests. Remember, Munich has about 2 million inhabitants. We have more than 6 million guests who every year consume about 6.7 million liters of beer in the 16 to 18 days that the Oktoberfest is taking place in late September, early October. Should be named Septemberfest, but this is of course not when it was initially started, and September is only chosen because the weather is better in Germany in September than in October. The Oktoberfest, fortunately, is imitated all over the world, spreading German or Bavarian cheerfulness and festivities, and therefore the Oktoberfest is the most famous German word in the world. Very fortunate, I should say, because we all know, and especially as we Germans know, the words that remind us of the despicable and embarrassing situations and things that Germans have done to others all over the world, and that are named with words. But the Oktoberfest, the festive Oktoberfest, is fortunately the most well-known German word all over the world. So in essence, the Oktoberfest, and now I should say as well as rheumatology meetings, it's a lots of fun experience, it's excitement, and we have many happy guests for these 3 weeks that we invite the world to come and celebrate with us. What does it have to do with rheumatology meetings? Well, we do have at the Oktoberfest about as many guests per day as we have patients with rheumatoid arthritis in Germany. So that's just the statistics. But we do have some problems with the Oktoberfest. And this is that we have temptations, that we have loss of individual controls, that we have problems with individual guests, that we have situations that we should better take care for. We do have an infrastructure problem. This, in fact, is the Autobahn, where you always think that you can drive as fast as you can. Well, can means in this time 0 to 3 miles per hour because we have congestions. This is, in fact, just a few miles south of Munich in October when people come to the city. We do also have lots of pricing during the 3 weeks of the Oktoberfest, which is astonishing. This is the main hotel price, and that increases by 128% just for the 3 weeks of the meeting. So it's impossible to have a rheumatology meeting, in fact, here in town while the Oktoberfest is running. And I should say, I met Artie some 15 years ago here in Munich at the first weekend of the Oktoberfest, and I still cannot understand how the company that invited him and me to have a meeting here in Munich was allowed to do so, because simply the prices are skyrocketingly high during the 3 weeks. And we do have something that is similar to what we have in medication. There's an overall price increase over the last 15 years or so in yellow, but there's a specific price increase for the beer of the Oktoberfest, which is way above the general price increase here shown in blue. So that means that things that become attractive get more and more expensive, and we should take care of this in a situation that we want everyone to participate of what the Oktoberfest brings to us. That means excitement and fun, and not only those who can afford it. And something more private or more of our own situation here, my university, in fact, the situation on my desk where I'm sitting at this moment is about only half a mile from the Oktoberfest. And you can all guess what that means for the medical personnel here during the 3 weeks that we have the millions of guests coming by and sometimes needing medical help, usually not for medical emergencies, but for things that could have been avoided if just taking alcohol and other things more carefully. Overall, I think the Oktoberfest and the rheumatology meetings alike, they are fantastic events full of positive emotions. It's experiences, if handled properly. And I think the last 3 years have shown us in both situations that the Oktoberfest as well as the rheumatology meetings, they do face a situation that needs changes and that needs to be handled with very caution and care in order to keep the Oktoberfest, but also rheumatology meetings as purposeful and joyful as they are intended to be. I was in charge of the 2011 annual meeting of the German Society of Rheumatology here in Munich, the all-virtual annual meeting of the German Society of Rheumatology in 2020 in Munich, so the first year of the pandemic where we canceled the meeting as well as other meetings all over the world, but we had the virtual meeting. And I was also in charge as the scientific chair of the 2022 hybrid EULA meeting in Copenhagen. And I think during the 10 years or 11 years, we have experienced and witnessed that these meetings have been transformed from all physical to all virtual. And they have evolved into a hybrid structure now, similar to the meeting that all of us and me are attending at this moment, with physical and virtual contents. And I think this is very well regarded that this happens to the good of the events. Why do I say that? Because I think the challenges that there are plentiful for both, for festivities as well as as rheumatology meetings. Time has changed. The work-life balances simply do not allow the continuous absence of home for many of us for several days. In future times, I would have traveled to Dallas. It would have taken me 1 day to travel, 1 day to travel back, and about 3 days to recover from jet lag. Today, I can do it virtually, and I can assess and address you as if I were physically present in the same room. We have to consider air pollution, not because air pollution is in everyone's thinking, but in fact, air pollution has to do something also with rheumatology. We have to think about whether we traveled 6,000 miles for a 15 minutes talk or even 200 miles. Why would I say that? Because the air pollution is a global burden of disease problem. Here, number six in the list of the most of the highest numbers of death by risk factor, if one takes just the outdoor air pollution, and if one takes outdoor and indoor air pollution, estimation is that we lose 5 million people per year simply because of air pollution. And this has also something to do not only with what we all would consider to be air pollution driven, like tracheal, bronchial, lung cancer, cerebrovascular disease, lower respiratory infections, and so on, but also rheumatic diseases. From Italy, a study published last year, a wonderful association between air pollution in Italian cities and the likelihood of developed rheumatoid arthritis and other inflammatory rheumatic diseases. Shown simply here that the odds ratio of developing rheumatoid arthritis is directly associated with the content, with the dosages of polluting small particles in the air. So I think, in essence, the future of Oktoberfest and rheumatology meetings are similar in that meetings should be very fun. They should really be what we all live for in order to see friends, celebrate with friends, celebrate our our specialties. They don't have to be big. And I should say, okay, at the Oktoberfest, you can't drink a beer without being physically present. But I think the medical meetings, rheumatology meetings, they don't always require physical presence as the one that you are attending at this moment. I think hybrid or all virtual rheumatology meetings, they allow the attendance of participants during focus sessions from broad distances all over the world and also at individual consuming times, may that be during night shifts, at the weekends, or weeks after the meeting has come to an end. Of course, hybrid and or virtual rheumatology meetings will have to gain acceptance throughout the guests, but also have to be well prepared by those who organize the meetings. And I can tell you from the meetings that I have organized, or I was involved in the organization, it's lots of different organizational purposes and things that we have to consider in comparison to all physical presence meeting. But of course, hybrid and or virtual rheumatology meetings, they help to avoid global warming gases. And at the end, if we pay attention, we allow change and evolve with the times, we will not experience the sad or lost moments that we had. This is the Oktoberfest ground just now or in summer, and it looks really sad. And this is, on the other hand, the ground of the airport of the EULA meeting when no one was there and one was thinking, why am I here? Because the EULA meeting is something that is sad and lost place. No, if we don't have to do this, if we pay attention, we will have the other way. We will look forward to Oktoberfest 2023. We look forward to EULA 2023, and we have joyful anticipation of these meetings. And we can then certainly celebrate the carbon dioxide in the beer rather than fearing it in the atmosphere. With this said, once again, thank you, RD, thank you, Jack, for inviting me. Have a wonderful meeting in Dallas, and thank you for your attention.